Well, welcome to this UK product demonstration video for the new Dextromethorphan rapid strip test. Cut off with 100 nanograms. Dextromethorphan is an interesting cough suppressant, really, sold as Robitussin, but in high doses can cause euphoria and hallucinations, and it's increasingly become a drug of abuse, so it's necessary to have a test available to detect its use. This is it. It is a simple dip strip test. This is what you can have in the pouch as shown behind me. DXM is the coding for it. This is the dip end with the wavy lines. You dip the test strip to around half the depth of the wavy lines. The results come up in this flat central section, and the handle end contains the coding. So let's show you how to run one. Just with a fresh sample of urine, dip the test strip in to around halfway up the wavy lines. No need to dip it right to the depth, and you'll see starting to wick in the central portion of this test strip, that pinkish dye discoloration occurring. As soon as you see that running through around halfway through the results flattened window, you can remove the test strip from the sample and then just lay it flat on a non-absorbent surface. And the read time for this test is, as with all these test strips, between 5 and 10 minutes. So what we're going to do is pause the video now and come back and demonstrate the results shown on this test strip and how you interpret those. Okay, well, welcome back. We've now had a 5 to 10 minute development time on this test strip, and you can clearly see in the results area we've got nice two lines formed, a control line, which is the line that forms nearest the handle end with the coding on, and the test line or the results line, which forms nearest the dip end. Two lines are a negative result, and even if the test line is thinner and fainter than the control line, it still must be interpreted as a clear negative. If you don't have a test line forming but the control line forms, you must allow 10 minutes development time for a T line to develop and start showing. If no T line is showing at 10 minutes, then that is an indicator of a positive test result, and that should be confirmed using an accredited laboratory method. Negative results can show as early as 1 to 2 minutes, and as soon as a test line has formed in the presence of a control line, you can interpret that as a negative result and move on and test a further sample if needed. The T line will not disappear or faintly disappear or reduce in its clarity over the course of the 10 minutes development time. Once it's there, it's fixed. So there's a demonstration for this new test strip. It's available on UKDrugTesting and Drug Testing Kit. We'll pop product links in the description of this video to take you through to the listing for this particular test strip. We have a variety of new test membranes just coming online this year, so it may be worthwhile you having a browse through the website for some of the newly added combinations and single strip tests available from UK Drug Testing. Thanks for watching.